respiratory droplets, which happens when we cough, sneeze, talk, sing, you name it. We are expelling these things from our bodies all the time. And that's why that social distancing is such a critical tool, because normally gravity and fresh air are going to do a lot of the work for us to disperse the virus in a way that's not going to allow us to really get what they call a dosage that's large enough to get you sick. When we start to go indoors, and as we all know, believe it or not, it's the beginning of August. And as we all know, in probably 6 weeks or so, we're going to start moving back indoors. And we're going to have to really think about air quality, filtration, and other things in enclosed spaces to deal with the aerosol that's created that could potentially get us sick. So we have some great resources we posted on our Michigan Department of Labor homepage, which includes best industry practice, which were created by the work groups the governor formed, which many of you may have participated with. We also have some information there from ASHRAE, which is the American Society of Heating, Refrigeration, and Air Conditioning Engineers. That's a very long name, so ASHRAE is much simpler. And they have some steps that you can take within your businesses or locations to deal with COVID too. Now, some of those, when we think about ventilation, are quite large, but they also have some tools in there that are much simpler. And it can be increasing the amount of fresh air in your location. It can be adding a higher MERV rating filter that can take out more particulates, or other tools. So I'm going to share my screen now and run through some slides. But one of the questions that we always get is regarding the enforceability of these executive orders and other things that we have. Now, Lawrence Hidalgo, who is the director of the Construction and Safety Division within MIOSHA, is going to talk to you more about that. But we absolutely have the tool we need to make this enforceable, including a potential penalty if we need to. It's the general duty clause. Every employer in Michigan, with some limited exceptions, and there are some very limited exceptions, are basically covered by the MIOSHA Act. And that requires all employers, there's a number of standards that you have to abide by, but it also requires all employers to provide a workplace that is free from recognized hazards, COVID clearly being a recognized hazard. So that exists, but that's not our primary tool. MIOSHA educates, which is one of the reasons that Lawrence is with me today to talk to you about all of the things that we're trying to do. So one of the main things we've been trying to do in the Department of Labor is to get open and stay open. And we're doing that by communicating across agencies. That includes licensing agencies, the Department of Health and Human Services. I'm on regular calls with local public health, and we're all trying to coordinate the best that we can to provide you the information you need to do the things that you should or could be doing, as well as to make sure that we are enforcing the executive orders and other requirements to the extent that's feasible. We are also building tons and tons of communication tools and other things that you may need, and we are posting pretty much all of that stuff at this wonderful website. It's michigan.gov/COVID workplace safety. And on this site, we have MIOSHA created guidelines for every industry that has been named in an executive order. And we have general industry guidelines for those that have not been named. Now, if you see your industry there, you will also find those general industry guidelines in every presentation as well, because those apply across all industries. And then there are more specific for those industries that have been named. We have some posters and other tools on there that you can use for your place of business. It can be, some of these are the masking requirement posters. There are other things there about customers coming in when they're sick. There are really simple 2-page fact sheets for just about every industry that's been named that kind of highlight some of the key components of those guidelines. There are some other links and tools there, and Feiruz has been wonderful in helping support MIOSHA with translation services. So we do also have most of these materials, not the guidelines yet, but most of these posters and fact sheets in alternative languages as well. So those are available there on that website. Through Friday, MIOSHA is currently taking applications for a safety grant program. This is for purchasing PPE, equipment, ventilation, sanitizer, you name it, for your workplace to make it more safe. Those are matching grants of up to $10,000. I believe Lawrence will cover those a little more deeply than I will, but certainly we're here for questions when that's done. The application period closes on Friday, August 7th, and you can find that link on that same website as well. Here's just a few examples of the posters that we have, and we have some, as you can see, that are geared toward restaurants with the waiting area. The no mask, no entry is the law. That's in compliance with Executive Order 153. 161 is the executive order that has the workplace requirements. The MIOSHA team early in the crisis set up a wonderful hotline that is available for employers and employees. It's 855-SAFE-C19. If you have questions about your workplace, whether you're an employer or an employee, and that'll get you right into MIOSHA. The average wait time right now is about 15 seconds. The average call lasts about 5 minutes. When you're thinking about things you need to do in your workplace, feel free to give them a call. If necessary, they can get you over to the consultation team if you're an employee, and if it's necessary, they can get you over to the complaint process as well. We also have some great links on this page for other things you may need. So the Michigan Economic Development Corporation has designed the Peer Michigan Business Platform, which can connect you with Michigan manufacturers or providers of PPE. That includes facial coverings, plastic barriers, hand sanitizer, and other things you may need in your workplace. If you are listening today and you are a manufacturer, you can also connect your work to that platform if you're making those types of things, to make sure that they're marketing you as well. It's a great tool. They have capacity there for these products, and I ask them pretty regularly. As we all know, in many of our communities, and maybe some of you have switched over certain types of locations to make hand sanitizer or other things, this is a great platform for you to connect with to find those. Part of the executive order is you have to conduct a daily health screening for your employees, visitors, contractors, and others. And one of the ways that you can do that is to use the My Symptoms app. This was developed by the University of Michigan and the Department of Health and Human Services. As an employer, you go and log on as an employer. You'll get a specific employer identification number. You give that to your employees, and then they can answer the health screening questionnaire right from their smartphone or their desktop or laptop or tablet or whatever it is they use. And that will cover the health screening component for you. There are a couple of caveats there. In manufacturing and meat processing specifically, you need to couple that with health screenings before people come in. In other industries, temperature screening may be required where possible. So construction and labs and a couple of those, you should be thinking about doing the temperature screening if it's possible. Certainly for those open to the public, there's no requirement right now that you are temperature screening customers coming in, but certainly the grant program or just being a little more proactive, if you're capable, that might be something you'd want to consider. But that My Symptoms app's a great tool. It's free. And it'll cover the screening. They're building out a portal right now for real-time information. So if you are using that app right now, you still need to take a look at the person's phone, and it'll show you a green screen if they've passed the screening. If they're orange, it tells them to notify you immediately and not to come in because they've flagged for symptoms of COVID. And then, of course, we have links over to the Michigan Safe Start Plan, which are the phases of reopening, and a lot of good information there, as well as the DHHS Mask Up Michigan campaign. The science, is telling us that about 40+% of the folks that are spreading this thing are either asymptomatic, meaning they'll never get sick, or they're pre-symptomatic, meaning right now they feel fine. So that's why these facial coverings are so important. And coupled with that is some of the science telling us that may reduce transmission by about 70%. So it's a clear path forward for us to maintain social distancing, practice that good hygiene, and wear the face coverings when we can't maintain social distancing so that we can get our numbers to the right spot. As we know, we've been watching the COVID map, and we've been having these spikes and everything else, and we do not want our economy going in and out of these sort of shutdowns or partial shutdowns or anything else. Our goal is to get open and stay open. So if we do these things together, if we follow the executive orders, and if we think of them in that concept that the goal is to stay open, they start to make a lot more sense. And we all have to be committed, because with something like COVID, one of the challenges is that by the time we potentially find or spot the bad actors, this is going to have spread significantly in our communities. So, and as those numbers climb, you know, the governor and DHHS are watching those numbers, and they're going to make decisions based off where our community spread is going. So we have to work together all the time to try to control that to the maximum extent that we can. And we need to do that as employees, as employers, and as citizens of the state of Michigan, because protecting our community and our economy are going to go hand in hand throughout this virus. So we're going to be around for questions. So as you can tell, I always say this, I could talk forever, but I'm going to go ahead and stop there and turn it over to my good friend, Lawrence.
Well, thanks, Sean, and thanks, Farouz, and the Global Detroit for putting this together. I'm going to share my screen as well, or try to. Okay, it's saying I've got my slides up. Can you see those? Very good. So I am here with Michigan Occupational Safety and Health Administration. We call it MIOSHA. I am the director of the Construction Safety and Health Division. We have 5 divisions in MIOSHA. Our mission is to help protect the safety and health of Michigan workers. That's why we exist. We want to help everyone go home each day the same way they arrived at work. That's what we want. Where we start at is with our SET division, MIOSHA's Consultation, Education, and Training Division. And they provide to the employers and employees safety and health audits, lots of training, whether it be the MTI. This is a very formal in-class, and also almost always at no charge on-site training. So as we go through here and you see something that you say, oh, I need training in that, give our SET folks a call, and I'll have the numbers here at the end of the slides for you to jot down. We do have 2 enforcement divisions, construction and general industry. We go out and we look at job sites. Are they following the standards that we have promulgated to help keep employees safe and healthy? And if not, there generally will be penalty assessments to the employer for not following the standards. Lots of standards. They don't apply to all industries. You're welcome to get on our website and look at the safety standards, whether you're in general industry, safety and health, and with construction, also safety and health standards. And our SET division, we'll be happy to go over those with you. Also, there's a Michigan right to know law regarding hazard communication. You should have safety data sheets for any chemicals you're using, and including, a lot of us are putting more hand sanitizers out for our employees to use. And in fact, some of those are coming from local distilleries that have switched over and have started making hand sanitizers for businesses to use. There still needs to be an SDS going along with those hand sanitizers and any other products that your employees may be using. Also letting you know there's injury and illness reporting and posting requirements that employers need to do, and that may even involve COVID issues. Again, if you're not familiar with these, if you need help on filling out the required forms, feel free to contact our SET division. Right here, we have SET division number that you can contact. That's 517-284-7720. Also, you can submit a request for consultation on our website. I'll go over our website here in just a second. Okay, here's the slide with lots of phone numbers for MIOSHA. One other thing is MIOSHA is out right now inspecting businesses, retail, bars, restaurants. And if employers are not following the executive orders, well, then there will be some citations issued. You will get, as an employer, if you get cited, you will get a packet from MIOSHA. There will be appeals rights involved. Please make sure you read that. And if you wish to appeal, make sure you don't miss your deadlines. Also, I want to let you know that employers can't retaliate against employees for exercising their MIOSHA rights. So if they contact MIOSHA with questions, ask us to come out because they have complaints, you cannot retaliate against that employee for exercising those rights. Also down here at the bottom, you see MIOSHA website. It's michigan.gov/MIOSHA. Lots of good materials there. You can also like us on Facebook, follow us on Twitter, and subscribe to our YouTube. So also, you know, I want to mention what all of you are trying to do, what you can do to help your employees, because your employees are your most valuable asset when you have a business. So one, try to see where can your employees work from home. If they can work from home, that's the best thing we can do for them. If they can't, if they have to come in, we know masks are a necessity when people can't continuously have social distancing. Also, the customers that come in. You want to protect your employees, so you know, try your best to have the customers wear their mask as well. Also, as Sean said, some other things, some plexiglass for separation between customers and your employees, 6-foot distancing, hand sanitizers around, making sure that you're cleaning things that others touch. Maybe HVAC systems need to be looked at, and that's where the grant matching that Sean talked about could be useful. And again, that deadline's this Friday, I believe end of day. So if we can help you with that, get on our site and submit for grant matching. So I want to thank you for letting me talk to you today, and I'll hand it, I think, back over to Firuz.
Yep. Thank you, Sean and Lawrence. I put this in the chat, but we obviously it's 12:30, so both Sean and Lawrence were pretty diligent in getting through their presentations, even though they could probably talk forever, so that we could allow some time for question and answer from you all. So you can either place your question directly in the chat, and I think someone from the Global Detroit team is going to monitor that, but also maybe just take yourself off mute and chime in with a question.
This is Gracie. I have the first question. So can you explain in regards to how the grant works with the match? Because that was a little confusing for me to understand.
Sure. So MIOSHA runs a matching grant program. The way we've done this one is it's a new program specific to COVID workplace safety. If you have 50 employees or less, you would have to match 50% of your grant award. If you have 50 employees or more, you have to match 100%. So if your project were $10,000, let's say, and you had more than 50 employees, you could get a grant award for $5,000, and then you would have to match the other 5 to reach the 10. If you were less than 50 employees, you would match 50%, and I'm going to try to do the algebra in my head as quick as I can, but I think that means you would get something like $7 grand from MIOSHA, and you would need to match the 3,500. So that's 50% match. So we were trying to make it a little easier for those smaller businesses to maximize their potential grant dollars recognizing that they may not be in a position to match a full 100% of the grant funds. Now, your project could go to 20 or 30 or 50. I mean, you could go as high as you wanted. The maximum grant you can receive from MIOSHA is $10,000. So if your project were 15, you could get 10 from MIOSHA, and then you'd have to match the 5.
Thank you.
Any other questions? Well, then I have a question on the grants again, because I'm sure we're going to get plenty of follow up. I have a couple questions actually, and I apologize if you covered this, but one, is there a maximum number of grants you will be awarding, or I imagine there's a maximum amount of money in the pot? So if you don't mind kind of speaking to that quickly.
Sure.
2, do you imagine there might be another round of some sort of grants or something similar that businesses can look forward to or look out for?
Sure. The appropriation that we received for this particular grant was about $8.5 million. So we don't have a maximum number of recipients. We just have a maximum number of dollars. I think through yesterday, I think we're closing in on 900 applications. Not everybody asked for a full $10,000. And because it's a matching grant, you know, it's going to have varying levels. If we have funds remaining, we do intend to potentially open a round 2. But before Friday, I just don't know where we'll be sitting with funds available. A couple of pieces just to couple on with that, Fairuz, is that you'd have to do a few things. So you need to do a site-specific evaluation to your workplace. That can be the owner, it could be a consultant, it could be your safety director if you were to have one. But essentially, just somebody needs to be responsible for performing that evaluation. If you think about, you know, pick a industry, let's say it's a manufacturer, you don't have to have like a 38-page plan to sort through this. You just need to look at your workplace, recognize maybe your workers are close together. So I want to buy physical barriers. So you need to evaluate your workplace for those types of safety mechanisms. It could be hand sanitizer or washing stations or something like that too, that you'll need to submit. You'd want to submit the invoice. You do not necessarily have to have purchased, but the reimbursement part of this grant won't be made until you actually make the purchase. Whatever it is you're buying. So if that's plastic barriers, you would have an invoice from Sean's Plastic Barrier Company saying, you know, you need 10 of them, they're $1,000, I don't know. There was one other piece that I'm probably going to remember as we talk later, Lawrence, if you remember it off the top of your head, but so there's just a few things there. The application's online. It's, you know, it's pretty simple process. In order to receive grants from the state of Michigan, you have to register in their Sigma system. So there's a link there that you just register your business within the Sigma system. It doesn't take very long. It's not a big deal. It's just something they have to do for the audit things that we need to do.
Thank you. We have a question from Josie that says, so with the grant, the employer provide the matching funds to the vendor, and MIOSHA will provide their funds to the same vendor?
No, MIOSHA is going to deal with the employer that's applying for the grant. The employer would pay the vendor and submit receipts to MIOSHA, and then we would reimburse them. We would send the money to the employer.
Okay. And so then in regards to clarifying, so less than 50 staff, the employer applies for $10,000. And if awarded, the employer would be required to render the other $5,000?
Under 50 would be 50% of whatever they received from MIOSHA, over 50. So I think I see the question in the chat. So if they had less than 50 staff, they're gonna have to do half of whatever they received from MIOSHA. So I know the math. Lawrence hasn't harped on me, but some of the MIOSHA folks have said, like, this made it pretty difficult, but we were trying to be a little beneficial to smaller employers. So if you're less than 50 employees and you're doing that $10,000, that's your project, costs $10,000, it would be basically $3,500, $6,500. So the employer in that case isn't going to have to match dollar for dollar what they get from MIOSHA. They're going to have to match 50% of, it's 50 cents on the dollar of what they get from MIOSHA.
Okay, that's
I know it's
clear to me
complicated,
too.
but
yeah,
we're,
but it sounds a little clear. I get it. But for everyone who's Feiruz has added the grant link for the forms, so please check those out. But I wanted you to all, Sean, speak in regards to the actual preparedness plan. I know you briefly mentioned it, but I do know employers have to prepare a preparedness plan. What does that encompass?
Lawrence, do you want to take that one?
Sure. So after the employer reopens, they have up to 2 weeks to get a preparedness plan in place. And so they need to look at the executive order that applies to their business and address all those various factors that they're required to look at, such as, one of the things is mask. If a business is open, employees can't continuously, how are you going to handle the mask? When people are getting together, when customers are around, so address all those. And then I believe, Sean, you can correct me, isn't there some sample preparedness plans available for the employers?
Yes. So on that Michigan COVID workplace safety website, the MIOSHA team had developed a sample preparedness and response plan for medium and low risk employers. One of the things you have to do is categorize the risk of your employees. It'll help you do that. It's not as complex as it sounds. It's based on a hierarchy that was created by federal OSHA, and that most employers are going to fall in that medium or low risk. When we talk about high or very high risk employers, that's typically going to be medical providers, hospitals, those places where they have known or suspected cases of COVID. When we think about those businesses like yours, where you're conducting the health screenings, even if you're open to the public, you're not really dealing with known or suspected. That means they're exhibiting all the symptoms, and you're going to be, typically treating that person. So you're in the kind of zone of fire of the aerosols and everything else. So they have a template there right on that website that you can use. It has all the steps listed for what's required in the executive orders, including categorizing your workers. And it's a great tool, and I would encourage everybody to take a look at it.
We have a question in that, do they have to submit the preparedness plan? No,
you just need to have it available so that it's available for your employees, your customers, if you have union representative, your union representatives, and then of course any government agency that might come in.
Okay, we have a question.
You do have to conduct training though, and part of the training that you would do for your employees on the COVID response will be your preparedness and response plan.
And can you explain, in regards to training, what does that encompass?
So the executive orders themselves have a list, and those guidelines that are available on that website have them listed out as well, but there's some minimum pieces which include as you're returning your employees to work, you need to train them on your preparedness and response plan, the symptoms of COVID, how COVID spreads, proper hygiene, and a couple of other pieces there. And it's really well spelled out in those MIOSHA guidelines they've created for your type of workplace.
Okay, we have a question from Devon. Can you go over the site-specific evaluation again? Does it need to be in a specific format? Do we need to do a drawing of our facility?
So Lawrence, you might have better insight on that than I, but a drawing is always helpful, but not necessarily required, right?
Right.
It just needs to detail sort of the makeup of your workplace. It's not, like I mentioned, you don't need to spend, 20 hours this week kind of putting this plan together. You just need to look at your type of workplace and kind of identify those things that you would need as it relates to this potential purchase of PPE or other supplies to make your workplace more safe, and why.
Mm-hmm. That's correct.
And do we have any additional questions? I guess because a lot of the businesses I saw signed up here are more in the retail kind of restaurant businesses. And I wanted to ask in regards to how many people you can have in your place of business at a time, and how do you mitigate that with having space outside?
So it's different for restaurants and retail. So I'll talk about restaurants first. So restaurants have to limit their seating to 50% of their capacity. And one of the things that we talk about is, I know the fire inspector comes and tells you, hey, you can fit 100 people in here, but you also have to take into consideration your tables, because you can have 50% of your seating capacity, and you have to be able to separate your tables to that 6 feet of social distance. As you all know, because of the masking requirement, everybody coming in that door needs to be wearing a facial covering unless they're medically unable, or otherwise they meet one of the exceptions, which are few. And when you add outdoor seating, it's essentially the same rules. You're just adding to your footprint. So it's not as though because the street was open, you can, just do whatever you want because it's outdoors. It's still going to be that 50% seating, that spacing, face coverings required. That's getting up and going to the bathroom and everything else. They only take off their face covering when they're seated. In the retail space, it depends on the square footage of your store. If it's 50,000 square feet or larger, it's 4 customers, I believe, or 4 people, including employees, per 1,000 square feet. If it's less than that, I believe, off the top of my head, don't quote me quite right on this, I believe it's 25% of your normal customers. But we can look that up, and it is in the guidelines on retail as well.
Okay, thank you so much. We had a follow-up question. Devon, can you unmute yourself if you don't mind and ask the question in regards to the follow-up for the evaluation again, please?
No, I don't mind. I'm sorry, because I had another question I wanted to ask too, just because I want to be clear. So with the site-specific evaluation, so that just explains why you're requesting what it is that you need? Can you guys hear me?
Yes.
I'm not sure.
Can you clarify the question, Devon?
Yeah.
A little clarification.
So for your inspection, so are you, like, if you do a drawing of your facility and then you explain why you want to have this done to it, would that be sufficient for that, or do you just need to go into greater detail?
You need to go into just enough detail so you can train your employees on, and they can use that plan. And then when we come in, we're going to ask you for your plan and review it and make sure that it's at least meeting the minimum required by the executive order, that your employees have been trained on it and they understand how to use that plan. Now, I do recommend you look at the sample plans created on the website. That should save you some time and give you an idea of these are the things you're looking for. Like Sean said, you got to evaluate what risk level your employees have and prepare your plan accordingly. So I really recommend, if you haven't had one prepared yet, start at our website and get a sample one.
That it's not necessarily, I wouldn't call it a fill in the blank, but it's close, right? It's got all the steps you need in there, the things that you need to look at, things you need to consider, has some, included but not limited to type things that you could be doing. So that's definitely where you want to start, Devon.
Okay, and then just for clarification, plan doesn't need to be submitted with the grant?
Oh,
It said in there that it did.
yes, that would. That was the third thing I was trying to think of. Thanks, Devon. Yes, if you are applying for the grant, that preparedness and response plan needs to be submitted with it.
Okay, and I have one more question, I'm sorry. So if you were looking at doing something to your facility which would allow for the individuals to social distance more, would that be acceptable to apply for the grant?
Yeah, yeah, it should be. I'm trying to think of like things that you would be doing there, but yeah, I mean, it's enhancing workplace safety.
So so what we want to do is, right now there are 4 bedrooms in the home, so everybody doesn't have their own room. And when you're in a, a foster care facility, it's very difficult to social distance. So we wanted to add 2 additional bedrooms so that everyone could have their own room, and then it would give us another like common area. So that way we can protect the residents, we can protect the staff, and we can just social distance better.
I think it's creative off the top of my head. I mean, I understand it. The only thing we would need to connect it to from a MIOSHA perspective is how that enhances your work employee safety. All of these grants have to be tied to your employee safety as well, which certainly social distancing could help that, right? So.
Okay. Yeah, I think that's very important to highlight, and is definitely thinking about your employees. I know a lot of us think about our customers, but MIOSHA is definitely focused on you making sure that workplace safety is a priority and that you're taking the proper steps to also not only protect your customers, but that you're protecting your employees. Because if an employee comes to work and there's not the proper steps, they can also call and make a MIOSHA complaint against the employer. So keep that in mind. It's not only the customer you have to be concerned about, you also have to be concerned about the safety of your employees. So that was an excellent question. Thank you, Devon. And we have another question from Aaron. How do independent contractors fit into the MIOSHA plans? Does any of it cover them? Independent contractors.
That's an excellent question. If when you say an independent contractor, if there's no employees, if this independent contractor has no employees, then generally they're not creating a plan for employees. Now, a lot of times independent contractors then turn around and hire people and call them 1099 workers. Well, we're going to give more scrutiny to that under MIOSHA. Are they really employees that are just being characterized as 1099ers? But if they're truly an independent contractor, no employees, what they would need to follow is the guidelines of the establishments they go to. What's the preparedness plan say about people entering the business? And they need to follow that plan as well.
Okay, was that clear, Aaron, or do you have a follow-up? Okay, thank you. And then we have another question from Garnette. I am in the retail space and we only have 1 bathroom for a 3,000 square space. We do have a second bathroom that is not in use that needs updating. Does the grant cover this cost? This would give us an additional hand washing space.
I think that piggies back into the question earlier. If this is something you want to do to help your employees, separating them from a bathroom that the public uses, providing the space for them to do hand washing, sanitizing, I think that makes a better case for the MIOSHA grant. So you would want to consider that when writing your grant. How does that help the employee?
I guess for me, can you give a general overview of what you would apply the grant for? If you're needing, when you're saying safety, what goes under that? And if you can also share the link to the sample preparedness plan on the chat, we would appreciate.
Well, and you know, we interchange safety and health a lot. Really is more of a health issue in MIOSHA than safety. So if you're doing something here to enhance the or reduce the health risk for employees, that's what we're looking for. This is a health issue, and keeping our employees safe from the COVID virus, that's our goal. So that would have to be part of the grant application. The links, Feiruz, do you have those links, or you want me to try and grab them?
For the grants?
For the grant and the preparedness plan sample.
I'll send that.
Okay. All right, we have about 8 minutes. Does anybody have any additional questions?
It looks
And you
like
can
Sean has linked the plan, so thank you, Sean.
Yep, I beat Feiruz.
Okay. Let me see, I see one. So we have the link to the sample plan for those who were looking for it. Please look at the chat. We will try to copy this, hopefully. I copy it so we could share it back with you all, the notes and stuff, but this is all. I don't know if Feiruz or Sean and Lawrence, do you have any last minute things to add as we're coming to a close?
Gracie, I'll add something just really quick. You know, I don't know if you want to mention, as we were discussing this before everyone got on, but some of the train the trainer folks that you all have been putting on with Bridget as well, and Anthony from Sean and Lawrence's team, who's been helping with those. So I don't know if you want to let folks know about that.
Okay. Yes, we are recording the webinar, and we will share it for everybody. So we will definitely email everybody, at least that registered, and we will put it on our social media. In regards to, we do have another MIOSHA training, and this one is a train the trainer, but it also will help walk you through preparing a plan. So if you do want to join us, it is next week, Wednesday at 11 o'clock. So we will send that link also to you all if you want to register, especially if you work with other communities. We recommend that you attend that session so you would know all of the paperwork and all of those things that are required. In addition, we have a lot of small business owners. Today is the deadline for the Michigan grant. So if you all, we'll send you that link. If you all haven't applied, please definitely check into that. And also, if you are in Wayne County, there is an additional grant that you all can apply for. Again, we want to thank you all for joining us today. And thank you so much, Lawrence and Sean, and thank you so much, Feiruz, for putting all this together today. We hope you all found information that was useful. We will send you the copy of the webinar and share some of the links that they've shared with us. If you have any questions, please feel free to forward those questions, and we will also share Feiruz's information if you need to contact her office or our friends at MIOSHA. So any last minute questions before we close it out?
This is
Right.
Garnette. I had one other question, and that is related to, you know, in retail, you could go through face masks quickly, the employees with face shields, those can be reusable. The grant covers like how long of a period? You're talking about a month? Is it a couple of months, or what? just to try to understand the scope of that type of, you know, the sanitizers, all that kind of daily usage type products. Should I assume that it covers maybe a 3-month period or a 2-month period or 1 week? How do we, you know, what is the appropriate thing to ask for?
You want that one, Lawrence? You want me? I think it's whatever you can demonstrate. So if you have, you know, facial coverings, we understand that those are typically disposable. The cloth ones maybe last a little longer, but as we all know, those are not permanent either. They need to be replaced when they're too worn or no longer effective. So if you can demonstrate that need, you know, I would apply for it.
And you could you apply, I guess she's saying, could you say, I'm applying for this need for a year?
Or a week or 2 months or what? You know, that's what I'm trying to understand.
I don't know that we have in the grant specified a period of time. And as we know from the experts, this virus is going to be around for quite a few more months if we're lucky. And so I can't tell you how many months to put in for, but I would certainly do an educated guess of what you need and put in for that amount.
Okay. Okay. And my last question is relating, I have an art gallery, but I have 4 employees and I need to add a second framer to my backspace. So I'm trying to figure out it's about 1,000 square feet. And I'm trying to separate the space to allow for 2 people. And normally we don't need hand washing statements. That's why I asked about the bathroom question. But if we don't have a second bathroom, I would definitely need to put another hand washing location, you know, even just for if people want to come in and, you know, just to keep the bathroom from overuse. What do you recommend for something like that? Do I put a second hand washing station in the back? I mean, normally, like I said, I wouldn't normally need that. Or just focus on a bathroom?
That would be your evaluation. I would tell you that, so you know, I mean, there are temporary portable hand washing stations that exist, and you know, there might be other ways to do that if that's what you're considering.
Okay.
I hear a question. What about when you are participating in a community event? What kind of exceptions should you have in place?
Excellent question. Thank you.
Well, I don't understand the question.
Can you clarify, please?
Hello, this is Yvette Jenkins. And up on Livernois, I'm based on Livernois, and there's going to be the design festival that is occurring. And so there's going to be 2 different activities that are going to be taking place, one on September 12th and the other one on September 26th. Well, there's going to be tents placed out where people are going to be distributing PPE. In addition to that, if you have staff working that kind of event, you know, on an outside basis, it's not your typical in-store type of thing. So are there any other kind of guidelines that would be necessary? Like, for example, with social distancing. I mean, should you put something on the ground when you're outside, you know, so that you can signify what 6 feet looks like? Because I've noticed there's a lot of people who don't have a sense of space. And, you know, and if you're responsible for protecting your employee inside your space, you can have plexiglass up and, you know, stuff like that so that you can separate them. But when you're outside in front of the business, how do you handle that kind of situation? You know, so that you can still keep your employees safe in those kinds of situations.
I think you're on the right track, Yvette. I would encourage you to give that number a call I mentioned, 855-SAFE-C19, and talk through some of your particulars. You'll talk directly with MIOSHA experts. Similar
Could you repeat that number, please? Repeat the number, please.
855-SAFE-C19.
I'll add it to the, hey Yvette, how are you? I'll add it to the notes. I'll add it to the notes for you all, the number.
Thank you.
You're welcome. So that was really good. I appreciate it. We might have you guys back again for another session. Thank you so much, Fairuz. Thank you, Lawrence and Sean. And thank you for everybody who joined us today. We will provide you with the recording and some of those information links that, that they have provided for us today. Thank you so much. All right, well, it is 1 o'clock. Don't want to keep you all past your time. Thank you so much. And thank you, Kenzie, who we all are not seeing, who's been moderating this call. Have a nice, wonderful day. Thank you.
Thanks.
Everyone.